Hello, everyone. My name is Dr. Taisha Halston Richards, and I am a pediatric physician assistant. I'm currently practicing at Dr. Beverly Gaines and Associates, which is a private practicing pediatric office here in Louisville, Kentucky. I've come today just to speak with you a little bit about the field of physician assistant studies. I received my Bachelor of Science in Biology with a minor in chemistry from Kentucky State University, my Master's of Public Health with a dual concentration in epidemiology and health behavior from the University of Kentucky, my Master's of Physician Assistant Studies from University of Kentucky, and my Doctor of Medical Science from the University of Lynchburg. So one may ask, what is a pediatric physician assistant and what do you do? A pediatric physician assistant is someone who is basically a medical provider to individuals that are from birth to 21 years of age. So, in other words, I don't see anybody over 21. Once they reach the age of 21, I actually send them over to an adult doctor, basically. On a daily basis, some of my job duties include the following. I do well child checks, which are basically physicals or sports physicals, gynecological exams, which you all don't know much about because you're babies right now, but you will find out later on in life. We also talk a little bit about ADHD and other different behavioral issues in kids. We also see kids for sick visits. So if you have strep throat or the flu or just a basic cold or allergies, we're one of the providers that you may see in a pediatric office. This slide actually outlines a typical day in my life. I usually clock in around 8:30, finish my morning patients around 11:30. I usually go to lunch between 12 and 1, see patients up until about 4:30 once I come back at 1 after answering messages and phone calls and doing my labs and reviewing labs. I'm usually leaving the office around 5:30. So a lot of people will say, well, why did you choose the PA profession as a whole versus becoming an MD or becoming a nurse practitioner? I really, 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 really like the idea of being able to be versatile and being able to move around freely. Meaning, as a PA, you're trained in all the different areas of medicine. So, with me doing pediatrics for the last 13 years, I could turn around and do surgery next week because I've been trained in that area. And so I really, really appreciated the versatility of the PA program and the PA field as a whole versus if I chose to be a nurse practitioner or an MD, you're pretty much stuck where you're at unless you go back and get additional schooling. If you're the type of person that, really, really likes to move around like different areas of medicine, but still in the medical field, PA may be for you. One thing to think about in life, even though you're young, I want you to just think about a few short and long term goals, things that you want to accomplish in 1 year being your short term goals, and things that you want to accomplish in the next 5 years being your long term goals. This can be an easy road map for you in life. You can follow it to a T, hold yourself accountable. Um, and that way you'll know exactly which way you're going and which way you want to go in life to have a great career and have a job that you actually love. I hope I'm giving you a little insight into the pediatric physician assistant world. Thank you so much for having me. It has been my pleasure. Do well, do great in school, have a great summer, have a great rest of the school year. And if you have any further questions or concerns, you can always give me a call or email me. My information is on the following slide. Have a wonderful day.